Hey guys, welcome to Thrive Bites Podcast. I'm your host, Dr. Colin Zhu, and thank you so much for listening on. You could have been anywhere in the world and you decided to spend just a few moments of your precious time, and we greatly appreciate it. Here on the podcast, we talk about three things: living a plant-powered lifestyle, enhancing emotional resilience, and creating a thriving mindset. And I interview a range of passionate guests such as physicians, dietitians, coaches, entrepreneurs, and many more. And please join me as I deliver these engaging, informative, and high-valued conversations for you. So what are you waiting for? Come on inside. What's going on, everyone? This is Dr. Colin Zhu, aka TheChefDoc, and we have another great episode for you guys today. I'm going to have Dr. Josie Bidwell. She is a nurse practitioner extraordinaire, and she is well entrenched in lifestyle as well as culinary medicine. She's doing big things in the area of Jackson, Mississippi, and be able to serve her population in such delicious and creative ways. You don't want to miss this, and I'll see you guys inside. Okay, guys. Well, welcome to another episode of Thrive Bites Podcast. I'm your host, Dr. Colin Zhu, and thank you so much for being here with us. You can have been anywhere in the world, and you decided to share your precious moments with us, and we greatly appreciate that. And we have a lovely guest with us today. I am so stoked for our guest. She wears many hats, has so many accolades. We would take the entire episode just to name it all. But her name is Josie Bidwell. She serves as a professor at the University of Mississippi Medical Center School of Medicine, with a secondary appointment in the School of Population Health. She serves as clinical director of preventive medicine, where she leads the lifestyle medicine clinic, where she includes a main location on the academic medical campus, as well as a satellite clinic within a community YMCA. She also leads the Kitchen RX culinary medicine program, which she provides cooking demonstrations and hands-on classes for communities, patients, and employees. She's board certified from the American College of Lifestyle Medicine and also the International Board of Lifestyle Medicine. 2022, she was inducted as a fellow of the college. She's the host of Southern Remedy Health. I just love the name. Southern Remedy Health and Fit on Mississippi Public Broadcasting Think Radio, and she was also appointed the director of the Office of Wellbeing at UMMC in July 2024. So without further ado, please welcome her to the stage. Hey, Josie.
Hey, Colin.
I am so stoked for you to be here. Thank you so much for showing up. You know, you have a lovely spread going on, and we cannot wait to dive in. Tell us, everyone, where you're calling from today.
I'm calling from Jackson, Mississippi, actually inside my lifestyle medicine clinic in our back group room, where we do lots of cool things, but also where we do culinary medicine and cooking classes.
Awesome. So you said Jackson, Mississippi. Give us a snapshot for those who have never traveled to the state of Mississippi. What is their take on food? How is it eaten? How do they treat food? Give us a little bit of flavors of that area.
Food in Mississippi is a huge part of everyday life, as well as all of our celebrations and really every facet. And, you know, we're known down here in the South for really delicious food. Sometimes it may not be the healthiest food options, but everything is delicious. Everything is usually homemade, made with love, passed down from different generations. And so that's one of the things we try and do in our classes is honor those things and honor those cultural traditions that we have, and not take foods out of people's palate, but how do we just maybe trim some things out of that or learn some different techniques that will make it fit in a more balanced dietary pattern.
Gotcha. You know, looking at your resume and going through all the different certifications that you had to go through, how did fast forward a little bit and we'll come back to your origin story. How do your patients respond? Do they look at you, with a tilted head, kind of like a dog? Is there the cartoon question mark above their head? How do they respond initially? And then how do they respond to you now?
Yeah. So initially people are kind of surprised that this is a thing. There for so long we've done just the very traditional medical model and, expert and telling folks what we're going to do or writing prescriptions and those different types of things, to come at it from a completely collaborative aspect and really work one-on-one with people. The initial response I usually get is, where was this 10 years ago? And, or I had never heard of this before. I wish I had been doing this, all along. And that's why I do it. Right. And that's why we've continued to grow and grow. When lifestyle medicine started, it was just me. And, now I have a whole team of individuals who help me deliver lifestyle medicine. And it's really for that very reason that most people want this type of healthcare and want this type of information. There's not enough of us out there practicing this way. And so we've got to spread the word about it. We've got to train more clinicians to practice this way. And we have to continue empowering patients to take really active role in their healthcare.
I'm very humbled and privileged to have you on the show because I don't actually have too many nurses, on the show. And I'm just really taken aback by the initiative, the motivation, the drive, and the passion that you have to the profession, the specialty, to the craft. It's not easy. Culinary medicine, lifestyle medicine, for those that are entrenched in it, it takes not just years, blood, sweat, and tears and years, right? But it takes a certain amount of gusto, right? And every pun and every aspect to be able to say, hey, you know what? I want to take that extra mile for my patients, right? So my first question to you is, what initially drew you to the nursing profession? And what was after that? What is the turning point or the milestone to say to yourself, hey, I really need to up it a notch and then include lifestyle medicine into it?
Yeah, absolutely. So I always knew I wanted to be something in science or in healthcare, even as a little child. And my mom actually developed a fairly debilitating neurological condition when I was about 9 years old, and had lots of involvement with the medical team, lots of testing, lots of different treatments. And she wound up with a PICC line and needed somebody to help her take care of that. And so I very quickly became the in-home nurse at the age of about 11, learning how to change PICC line dressings and give medications and all those things. And that really lit the fire in me for pursuing a career in healthcare. And, one thing just led to another. I went back and forth between, do I want to go to medical school? Do I want to go to nursing school? Ultimately, met my husband that I'm married to, and the timing worked out best for me to go to nursing school. So I went to nursing school. He was in graduate school. He's a biochemist. And I still thought, I might go back to med school when I finish this. I don't know if this is the right spot for me. And the first patient that I took care of, I knew this is it. This is what I'm supposed to do. This is my calling. I'm supposed to be here with these patients at the bedside. And that's really what I did for several years. I was an inpatient nurse in our children's hospital. So I worked night shift, worked with kiddos, inpatient, and really probably bugged all of the physicians that were there, because nights are a little slower sometimes. They're not easier, but sometimes they're a little lower key. And so I would just ask if I could go on rounds with them when they would be going and doing things so that I could learn, and just fell in love with needing more information about how to take care of patients. And so I went back to graduate school to be a nurse practitioner. And that's really when the lifestyle piece started to come into play. And that's been 20 years ago. Lifestyle medicine was not even a glimmer of me knowing what that was. But I had a rotation with a nurse practitioner who worked in endocrinology, and she served as their diabetic educator. And she also did all of their diabetic foot care. And she had the coolest stuff in her exam room. She had food models and, picked little models of plaque in the arteries and all these different kinds of things. And so while she's doing foot care on these folks, she's teaching them about how to eat to control their blood sugar. And I thought, this is it. This is what I want to do. I want to be able to help people like this because I could see it. I could see their numbers start to trend down and their wounds start to get better and all of these things. And so when I graduated, when I moved into practice, it was a little different time in the scope of healthcare. There weren't a ton of nurse practitioners, at least here in Mississippi. And so I accepted a job doing internal medicine and pediatrics. And I took over all of the diabetic management in that particular clinic and got to do a lot of the nutrition and a lot of the titration of insulin and all these different things to help folks. And that was really the part that I enjoyed the most. And then I had a baby and thought, you know what, maybe I will be a stay-at-home mom. And loved my kid, but missed working with people, missed being with patients.
You're like, kid, you're good, but I got other kids to attend to.
I was like, I think we need a part-time so that we love each other. And so I went back to work as a school-based nurse practitioner and joined the faculty here at the medical center. And really what I saw with those kids was just an increasing prevalence of childhood obesity and lack of understanding about what foods we needed to have more of, what to do with those foods if we were able to get them, how to make them taste good, all of those different things. And that really truly kicked off me trying to decide how we do this on a bigger scale. How do we develop programs and initiatives so that it's not just that one kid I'm seeing in clinic or that one parent that I'm talking to, but all of our population, because they have these same questions too. And so lots of other things occurred during that time. And I moved into being clinic director of some other clinics and met our preventive medicine chair who was new coming in, and he needed to start a clinical service line. And he said, can you help me do that? And I said, I can if it's lifestyle medicine. I said, I want to start another primary care clinic. I want to start a lifestyle medicine clinic. And that's what we did in 2017. And the rest is history. So we went from a half a day a week of lifestyle medicine practice to 5 days a week and 7 other people in this clinic providing lifestyle services and over 5,000 patient visits last year.
I love it. And I can't wait for, the institutions, the health systems to be able to hear your story and similar stories because we need that inspiration. We need to be able to see the example that, it's been done, right? It is possible, right? There may not be a one size fits all, in terms of, because at the end of the day, it needs to generate some sort of revenue, right? Depending on if it
at least break even.
Yeah. If it's, depending on if it's like there's a certain setup, right? So it has to be able to please, every party as much as possible. Can you share with us your favorite, after so many, years of, clinical experience, share with us your favorite patient success story? Man,
there are a lot, but I have a button here in clinic. It's a little gold buzzer, and it's.
I was like, is it a Staples button?
It is, but you can record on it. So it is a recording of me singing, which, bless my soul, that is not a talent that I have, but just like a congratulations song for patients. And so every single time somebody comes off of a medication, or they have, no clinical evidence of that disease process going on anymore, or they get their joint replaced because they were able to, get their weight down and get their blood sugar down, or they don't need that joint replacement anymore. Anything that we celebrate, that we hit that button and we celebrate with that, even sometimes really, really small wins, and that's so important because patients feel so empowered when we do that. And so, my favorite patient stories are the ones where the patient tells me, I feel better, because it's not about what their blood pressure is at the end of the day. It's not about what their weight is. It's what's their quality of life. And do they feel like they can now go and do things? And I had a patient just the other day who we had been working on trying to get her risk factors modified so she could get her joint replacement. And it had been about 3 months since I had seen her. And when I walked in, she stood up out of the chair, not with a cane, not with a walker, not with rocking back and forth to get up or pushing out of the chair. She just stood up to hug me when I walked in. And she said, I can't remember the last time that I was able to get out of a chair without somebody having to help me. And that wouldn't have happened without, the work that she put in, because it doesn't matter, how good we are at our jobs, sure, but that collaborative process together and building a plan for her and then her putting in the hard work to get it done.
Yeah, it's so motivating because lifestyle medicine, culinary medicine is really about putting the onus on the patient at the end of the day. And in a lot of ways, what I love about lifestyle medicine is that it also puts the onus on ourselves as practitioners, as providers, right? Because if we cannot live and breathe the example, then I can't tell you the number of times, Josie, that I don't really need to convince my patients because they just look at me, right? I'm prominent on social media and they just know that, I'm the example. So I don't really need to convince anymore. You know what I'm saying? Because patients, I don't know about you, but patients don't really respond to facts and figures. They're nice, right? But sometimes you need a certain amount of finesse. And part of that, what I found is, that greatest asset. We were talking a little bit offline about running, right? So it's really about living your, example. So I'm so glad that, you've had so many that you can't even pick from to say.
Pick them all. They're so, and I would say that the vast majority of the patients that we see achieve some part of their goal that they set out to be, right? Mm-hmm. A lot of times we've had chronic disease for 15, 20, 30 years. Mm-hmm. And the reversal or the remission of that is not going to be quick. We're playing the long game with a lot of these things. But there are small wins that, sometimes are not recognized, especially if we're not moving a whole bunch of numbers in terms of biometric data, but that really matter to a patient. And that's an important thing for them to, feel like they have achieved, even if it's just they no longer drink soda. We're going to celebrate that because you are a healthier individual overall for being able to do that. And it's interesting you mentioned, trying to set the example. So we have a lifestyle medicine residency here. So I get to take 8 preventive medicine residents through the entire lifestyle curriculum. And they spend 6 months with us here in lifestyle clinic as well. And to watch their health behaviors change as they start to learn about the science behind lifestyle, as they start to see what we're asking our patients to do, as they start to see what we ourselves as the other clinicians here are doing, the behavior changes, right? We start to eat, while we may never get them to, completely plant-based, we start to eat more fruits and vegetables. When we have departmental meetings, it's automatically a healthier choice that's brought in for that departmental meeting. It's not pizza always, or if we're organizing a campus walk, they're showing up for those things, or they're asking if they can go do yoga on their lunch break. And I'm like, absolutely, you can. That's what we ask our patients to do, is find ways to sneak it in during your busy day. So let's go do it,
Yeah. Shifting gears, in terms of myth busting, what is the biggest myth or misconception that you keep coming across day in, day out, that you have to be able to debunk for your patients? What's the most common one that you come across?
Probably that healthy food doesn't taste good, or it has to be bland. And that's the biggest one we come up. That one and cost. Those two kind of go hand in hand. They see it as, not a lot of flavor, and that it costs a whole lot more money to eat healthy. Expensive. And, I'm able to run kind of recipe comparisons for them. And the meat is the most expensive thing you're getting at the store when you're building a recipe. So when I can show them kind of head to head what a bean skillet that we're going to do today versus a regular taco skillet, what the cost savings are on that, they're like, you know what, you you might be right. And then they have to taste it, and that's my favorite part, because I have them write down different things on there. And the one I had this week, the comment was that no meat meals can taste good. That was her favorite today. And I was like, yes, my work here is home.
So specific to your area, Jackson, right? When I talk about cost is, one of the biggest barriers and limiting steps. I like to talk about, depending on the region, every city, town has their own regions, has their own access and different qualities and spectrums of supermarket, grocery stores, things like that. What is specific to Jackson? What is the area like that you are able to enlighten for your patients? Are there wholesale clubs? Is there farmers markets? Or what is it that you can help them to be able to offset the cost that you're referring to?
Mississippi is really rural. So we're in the metro area, the kind of busiest, most populated area. And even within that area, there are going to be food deserts or just lack of good quality grocery stores. And so a lot of our patients shop at Dollar General or Dollar Tree or, those types of places. We do have farmers markets. Lucky here in the metro, we've got a very large farmers market that has tons of vendors and lots of cool stuff there. But the rest of our state may not have quite as much option for that. I'm from the Mississippi Delta, so smack in the middle of the most rural part of the state, also the agricultural hub of the state. But a lot of those items are produced to be shipped out, right? Corn, soybean, rice, cotton, those types of products there. And so we're really looking at how do we get more farmers connected to places to sell their produce. I'm working on some projects with that so that we can get people connected. I got the tomatoes from that farmer right down there. Go do that. The lack of walkability of the state sometimes can be a barrier because everything is spread out. Everything here is passive transport. Like there's not a lot of walk to work situations. There's not kind of downtowns where everybody hangs around that area, and that's kind of the hub. So I grew up about 30 minutes away from the nearest grocery store. So it was not I'm just going to run to the store and grab something fresh to make. It was, we're going, once a month and make a big grocery haul. What Southerners do really well is we can really well preserves and all different types of things there. So really right now we're in the height of garden season. And so, teaching people how to preserve those fresh things that they're growing, and then how we continue to use those also all winter long.
Awesome. That's very important as well. Storing, preserving, we talk a lot about fermented foods, working with the seasons. So I'm glad that, you include that as well. Let's shift gears. Let's focus on the demo portion. Yeah. And as you're doing the demo, I would love for you to enlighten us about your program, KitchenRx.
Hey guys, what's going on? This is Dr. Colin Zhu, and we are very, very excited to officially announce that we are starting a cookbook. This has been a long time coming, and this is the pre-order campaign, and we are so excited for this project. So guys, as a reminder, we live in a world where 72% of us are overweight, about 40% are obese here in America. More than half of the top 10 causes of death are attributable to dietary and lifestyle changes. The top 2 being heart disease and cancer year after year after year. 1 out of 3 of us are pre-diabetic. We live in a world where we are immersed in ultra-processed, calorically rich, and nutrient-poor foods, as well as animal-based foods. And this leads to a whole host of problems. And yet, 88% of countries outside of America face 2 or 3 forms of malnutrition. And not only that, our soil health is very poor due to modern agriculture, which is 99% of what we practice here in America. And that leads to a lot of issues in terms of biodiversity loss, in terms of soil degradation, a lot of resources being used because of animal agriculture. And that has a huge environmental impact and also an impact to our individual health. So the aim of this book is to connect all of these dots, how our food choices affect our individual ecosystems and how that creates a ripple effect to our community and towards planetary health. And so I am enlisting a lot of my friends and colleagues. We're going to have over 25 experts ranging from physicians, chefs, dietitians, environmental experts, and farmers to collaborate to write this book. The book is a cookbook which is filled with plant-forward recipes that are both seasonal, balanced, traditional, multicultural, and nutritious and delicious at the same time. It's not just going to be a cookbook, it's also going to be a strategy book as well. So this pre-order campaign is to not only get your copy of the physical book, but also a digital copy. And if you order for this pre-order campaign, you'll also get free access to the TheChefDoc Academy, which has been 8 years of work and valued over thousands of dollars. The aim of this book is to get over 1,000 pre-orders in order to get the best traditional publisher to make a massive impact. And so, guys, be part of a movement, not only be able to find all the things that you want to do for your individual health, but also for your family and community, and play an actionable role to be able to save the planet that we're on now. So, click on the link to find out for more information, and we can't wait for you to join this movement, and I'll see you guys on the next one.
All right. So Kitchen RX is really evolved over time. In my past couple of years, I ran an actual brick and mortar teaching kitchen that we did for low income individuals. And that was a grant funded program. When that grant ended, unfortunately, it ended, but I wanted to continue being able to reach people. And so during COVID, when everything was shut down, I flipped to virtual, and that's where Kitchen RX really came on board. So I would do cooking demos from my garage, in particular, trying to help people put together a meal that didn't have meat in it because you couldn't get any meat at the grocery store anyway. So once everything started to open back up, we moved into Kitchen RX as an official thing. And so we do it for patients. We do it out in the community for different things. We teach our residents Kitchen RX, and then I offer it as an employee benefit here from the Office of Wellbeing. So any department on campus can request a Kitchen RX, and I go and cook with them, and they get to ask lots of questions. So this is our summer menu. We have different menu for each season because we do try and cook what is in season. Mm-hmm. And we try and teach a formula so that people can swap ingredients out depending on what the season is. So everybody loves taco night. So we do a taco skillet here. And so we'll start with some onion. Pretty much everything's going to start with onions and garlic if we want it to taste good. And we've got a Vidalia onion here, one of my favorite onions. But as I tell patients, it's whatever's on sale is what we're going to use. And then I've got absolutely nothing in this pan. I've got no oil, no butter, anything like that, because we're going to do a water saute. This is something that just blows everybody's minds when we start doing it. But I'll go ahead and add some onion into the pan. And usually they say, but girl, you didn't put any oil in there. And I said, I didn't. Let's think about why we have oil. We usually add that to keep something from sticking. And I actually want it to stick a little bit because I want all of the natural sugars to come out of those onions and kind of get brown and caramelized there, and then add some water or some stock to the pan to deglaze it and pull all those things up. When we're talking about making healthy food taste good, we have to look for free flavor and flavor that's not fats or salt. So that's free flavor in our pan. So we just spread that out and let those start to go. Now, some of the other things that we have are just vegetables that are going to be in season right now. So in the summer here in Mississippi, everybody grows zucchini in their garden. Everybody does. Even if they don't like zucchini, there's zucchini.
Why is that a thing? Why do they just...
Zucchini and yellow squash. It's always there. And once it starts to come in, there's just gallons.
No stopping it.
Everywhere. And nobody knows what to do with it. You know, they've got all this zucchini left over. And so we make zucchini bread and zucchini muffins and all these different kinds of things. But we've got a lot left over. When I'm teaching patients, I'm like, there's nothing special about the zucchini, any kind of non-starchy vegetable that you want, you could put in here. So if you wanted mushrooms, if you wanted bell peppers, any of that, just go ahead and add it, or all of that, right? So we're starting to get a little bit of brown. So I just add a little splash of water just to start to pull that brown up off the bottom. And I usually take it around and let everybody see all the good brown yummy bits off the bottom of the pan. And now this is when I usually go ahead and add some garlic. I don't add it before because it will burn. And there is no coming back from that. You know, there are most things in the kitchen we can salvage, but burnt garlic is not one of them. Once it's burned, you gotta start over. So we'll give that garlic somewhere to sit and somewhere to stay. And we just kind of keep an eye on it as that water starts to evaporate out and it starts to kind of stick again. If we're not ready to add our next thing, we just add a little bit more water in there or adjust the temperature on our skillet.
Josie, do you have any tips or tricks or hacks for not crying while cutting onions?
Yes, absolutely. My 2 tricks. So one is disrupt the root end as least amount of possible, right? So when we think about that onion, there's the part that grows up out of the ground and then there's the root. The root end has more of the substance that makes the gas that makes us cry. So if we don't cut through that a whole lot, then we make less of that gas. The second is get through it very quickly. So that's one of the knife skills that we teach in the class is how do we cut an onion? How do we dice it up quickly without disrupting that root end? And then my hack is wear contacts. So
I was like, is there lab goggles, as part of,
Yep, absolutely. So it's that gas that mixes with our tears that cause that. And so contacts or glasses help with that as well. All right, those are looking nice. They're starting to get nice and soft. I have not salted anything at this point because I wanted those sugars to come out. I didn't really want them to sweat or anything like that. So we're going to add the zucchini, peel and all. I got asked that question yesterday. And yes, peel and all, so that we can get soluble and insoluble fiber. So we can get cholesterol lowering and we can get colon health.
Cleansing.
Yes. So we've got that in there. And now I'm going to go ahead and add in some taco seasoning. Now we make our own taco seasoning and we do that for a variety of reasons. One, it's cheap to do that. You can make a big amount of it and then you can control the salt. When we're talking with people about sodium, most folks are surprised that most of our sodium comes from packaged products. It's not necessarily the salt that we season with while we're cooking, or even some that we may sprinkle over at the end to flavor right before we eat. That most of it comes from our seasoning mixes we start with, or our canned products, or pickles, or cheese, or any of those different kinds of things. And so, in making food taste good, we can still use a little bit of salt while controlling and having good control over that amount because we start with really fresh ingredients. So our taco seasoning mix features heavily with chili powder and paprika, and I use half regular paprika and half smoked. Another thing that I like to do when we're not using meat, here in Mississippi, most meats that we add to things that we're going to cook down for a while are a smoked meat, like bacon, or smoked turkey neck or smoked turkey leg, those types of things. And so it's very familiar to have that smoky undertone to our meals. And so smoked paprika is a great way to do that. It's how I make my collard greens, which collard greens are a pretty important thing down here as well. And most people can't believe that they don't have some type of meat in them when I do that. All right. So we've got onions, garlic, zucchini in here. And then kind of our last 2 things are going to be some tomatoes and then our not meat protein source. So with tomatoes, right now I'm doing Roma tomatoes. I like Romas just because the flesh to juice ratio is more flesh. So you get a little bit more substance with those. But here, literally everyone has tomatoes growing, whether it be in their backyard, in a container, on a windowsill, everyone's got tomatoes growing. So whatever tomatoes they have is fine. And this entire thing can usually also be turned into a pantry meal as well. So if we needed to use some low sodium canned tomatoes in this, that is not the end of the world, right? We're trying to get more vegetables in our diet, less drive-through, less fast food. And so we have to be a little bit flexible with those things.
In reference to meat alternatives, not in terms of processed, meat alternatives, what are some examples do you ask your patients to refer to? Is it, more tofu? Is it tempeh? What are your go-tos?
The biggest go-to is something that they can get at their regular grocery store or at one of those convenience areas like the Dollar General or somewhere like that. So it's usually going to be a bean or a lentil. Those are the two that we go to most often because they're familiar, right? Most everyone has had a bean at some point in time. So it's a little less scary for them. At least for the first cooking class that we do, we usually focus on some type of legume. Today, we're going to do black beans. Very readily available at all of those stores that we talked about. Red kidney beans also go really well in this particular recipe. Chili beans, and then lentils also go really well here. And we can actually get those at our dollar store for about $1.25 a pound from a dried bean standpoint. And that will make this recipe 3 or 4 times. So a very cost-effective option. Now, I did a class the other day for healthy snacking, and we did summer rolls, and we put tofu in those. And that was some of the first time anybody had tofu, and nobody looked terrified. Nobody spit it out.
Wait, hold on a second. You made summer rolls using tofu as the ingredient, or you put it into the summer roll?
Put it into the summer roll. So we did, carrots and rice noodles and cabbage and bell peppers and cucumbers and just a plethora of vegetables. Because my stance on snack time is that's when we get in more of things that we don't get at mealtime. And so a lot of times we don't get enough vegetables. So let's sneak them in at snack time. And just having raw carrots with hummus, while delicious, can get really boring as your go-to snack. So let's stick them in a wrapper and wrap them up and then think about how we make it balanced. And so to make it balanced, we've got to have a protein or a fat or both to do that. So we added some kind of crisped up tofu in there. And then we made a spicy peanut dipping sauce to dip that in so that we got healthy fats in there. We got some protein in there. And we got people exposed to something that they probably wouldn't purchase for themselves at the store, but that they enjoyed. And now maybe they will purchase that at the store. Again, a very affordable protein option, much cheaper than meat's going to be. All right, let's turn this down a little bit. So everything's in here. And it's ready to go now, right? Mm-hmm. But of course, the longer you cook it down, the veggies get more tender, the flavors get better, all of those things. And so then we talk about how we turn this into a full meal, right? So the way we do that, we use ACLM's Nourish Bowl template, which I love that because it's teaching a formula of how you make many, many meals based off of plant proteins and grains and greens and veggies. And so we start with a little bit of brown rice, right? So we've just got a little bit of brown rice here. And then we add something green to it. Today it's romaine. It could be cabbage. It could be anything that you wanted there. And so we add that in as well. Make our little Nourish Bowl. And then going back to that principle of, is this anchored, right? So we're going to get non-starchy veggies in here. We're going to get plant-based protein in here. But because we didn't use oil, we didn't use meat or anything like that in here, we are missing some fat. And that's where we really spend time talking about the difference between added fats that have been refined versus whole food sources of fats and all of the other things that you're going to get in that nutrient package. So we usually do guacamole as our healthy fat to add on top of this particular bowl. And then we think about how do we add additional flavor to this, right? So something either spicy or something acidic or both. So we make a pico de gallo to go on top of this as well, which I have some here, which is great because it pretty much just uses leftover bits from everything else we've already done, right? So we chop a few extra tomatoes and throw those in, chop a little extra onion, throw that in. The jalapeno goes in our guacamole, so we throw that in our pico, and then we add some lime juice. So we've got some pico here. And then we have some cut up limes here as well. And some guacamole. And yay, I squeezed some fresh lime juice on him before we started and prayed he didn't turn brown. And he didn't. Thanks for behaving. All right.
I might have missed this before, Josie, but like I know that you cater to the residents, the students, also the employees as well. How does Kitchen RX come into play for the public, for lay people, for patients? Do they cook alongside? Do they watch you as a demonstration? How does that play out?
We've got two options. So we can do kind of demos like this, but I don't pre-chop anything. So they watch me chop. We talk about knife safety, kitchen safety, all of those different kinds of things. And then they can watch and ask questions. And then we have a more hands-on option as well. We'll have different stations set up. The residents get the stations always so that they get to get their hands dirty and practice chopping and those different types of things and tasting their food, adjusting seasonings and that kind of stuff. In the public, we'll also do that. Our summer roll class the other day was a hands-on class as well, because I thought people probably had never rolled their own summer rolls before, and I was correct.
Mm-hmm.
But everybody made some moderately attractive summer rolls that may or may not have held together when they cut them, but they were equally as delicious. And then we'll do large demonstrations as well. Most recently, I had the opportunity to be part of the retention program for the atherosclerosis risk in community study, the ERIC study. Jackson is one of the 4 national sites that have been running that study for over 30 years. And so all of those participants were in their 80s, and they've been in this longitudinal study since then. And I got to cook for 250 of them. And we made things like roasted sweet potatoes and lentil meatloaf and collard greens, and had the best time watching those folks go from, she's doing what now? Mm-hmm. There's no meat in that meatloaf. What'd she do to those greens? To telling me that it was one of the best meals they've had. It's Kitchen RX is the best part of what we get to do out in the community. Tasting, yes, yum. All right. Let's grab a spoon out of here, and we'll add a scoop of our taco bowl to our brown rice. All right. Then we'll add a scoop of our guac.
Oh, I love it. Prepared.
And some of our pico. And then a piece of lime right on top to squeeze over. And then we've got a little burrito bowl.
You're going to have to bring it to the camera. Please bring it to the camera.
Yes. Ta-da. So now we've got,
And there you have it.
And there you have it.
Beautiful demonstration. Number 2, it's really about what I find is really about, flavor, presentation, literally colors of the rainbow. The fact that we can, see all that, with our biology means that nature equipped us to be able to search out, right? It's part of our evolutionary biology to be able to search out these colors. And when you're not eating plant predominant or plant-based, the colors are basically shades of brown, white, yellow. Like, I'm just trying to think of, that's not that many colors, right? So what's beautiful is that you expand the lexicon of, what we can eat, right? As well as flavor profiles, as well as vocabulary, right? Because I tell people that there's like 300,000 edible plants in the plant kingdom, and the average American only eats upwards of about 150, which I think is actually more than, I think an average American actually eats. So it's really surprising. But yeah, beautiful, beautiful presentation.
Thank you. Yeah, that's what this is about. None of these ingredients were scary, right? And I think when people hear plant-based diet, or they hear vegan, or they hear vegetarian, they do go to, well, what am I going to eat? Like, if I'm not having chicken or pork or beef or fish or these things, what am I going to actually eat? And these are all things that we eat already, right? Everybody's had zucchini, or a squash of some type. Everybody's had a tomato. Beans are so readily available, and you can sub in any bean that you want there. And so you can really almost see people visibly calm down when you say, like, this is what I mean when I say a plant-based or a plant predominant meal. Doesn't have to be tofu or tempeh or any of those things. It can be, and we want to expose you to those things as well, because they're yummy and delicious, and that's the point of food, is to nourish our body and be delicious and have joy around those things there. But kiddos will tear this up because it looks like what they're used to. It looks like a burrito. And you can smack all of this in a wrap and wrap it up and call it a burrito, if we want to kind of tuck those things in there and have it that way. But the clinic here loves when we do these, because there's usually leftovers, and then everybody eats all week long on all of the leftovers that are in the fridge there. And sometimes our patients do as well. They'll be like, you got anything left of that cooking class? I do here. Have some. Take it home.
Yeah. You're teaching batch cooking, you're teaching repurposing leftovers, you're teaching, meal prep, which is basically the bulk of the labor. Yep. And you're introducing them to so many different skill sets. Dr. Josie, Dr. Nurse Josie extraordinaire. 2 questions is, where can the common layperson find you, maybe see you as a patient, or maybe come to a demonstration? Yeah. And then also for the health professional that's not in the Jackson, Mississippi area, that loves the setup, loves the innovation, where can they find you to be able to pick your brain on, how can I be able to bring this to my institution?
Absolutely. From a health professional standpoint, one, I hope that you will come to the Lifestyle Medicine Conference in Dallas. I will be there. Been there every year since 2018. Those are my people. And I'd love to set up time to talk with you in person and kind of share some of the things that we've learned over time and help mentor you. If you want a little offline, less in person, LinkedIn is probably the best way to grab me from there. And we can always set up calls. Actually, a team from Kentucky just came down to spend a couple days with us to see how we've set up our clinic and how we do those things there. Patients can follow me on Facebook or Instagram. I go live and do cooking things from time to time there. My kitchen is being remodeled currently, so I haven't done one. Okay. I'm very excited in a little while. But I do things that way. And then the best thing is you don't have to have a referral to see us here in Lifestyle Medicine. So if you're in Mississippi or the surrounding areas, all you got to do is give us a call and come see us that way. We'd love to take care of you.
Well, keep doing what you're doing, you and the organization. What we also learn is that lifestyle medicine is a team. It's a team effort. It's the power of we, and you guys are doing it in spades. I'm so glad that you're spearheading and leading the way. So thank you so much for what you've demonstrated today. And I can't wait to see what you cook up next.
Thanks, Colin. I can't wait to see you in November.
Yes. Guys, this has been another episode of Thrive Bites Podcast. If you like this, please like, comment, and subscribe. And if you felt like this is a benefit for someone else, please let them know. And until then, please say goodbye to Dr. Josie. Bye-bye.
Bye.
Hey, guys, we hope you enjoy that episode. If you like that, please like, comment, and subscribe. And please follow us on Apple Podcasts, Spotify Podcasts, and anywhere that you listen to your podcasts. And if you felt that this was a benefit for someone else, please let them know. And don't forget to give us a 5-star rating, and we greatly appreciate it. And we'll see you on the next one.